Yes, hello everyone again. So today I'm here with my European Forest Institute hat on. I'm working for the Biocities facility here in Rome. And I'm going to talk about urban health and nature and the evidence and what needs we still have to improve the research and to put it into policy and practice. Did you know that around 43,000 deaths could be prevented in Europe if the cities lived up to the WHO recommendations of accessibility to urban green spaces? 43,000 deaths per year, that's quite a number, right? However, only 40% of the population actually has access to this. So there's clearly something we need to do about this, to take this even further from numbers to actually doing something about it. What are the, I said maybe like already here. So the WHO has recommendations around urban green spaces, and we might wonder, why does the World Health Organization bother about urban green spaces? Are they not supposed to bother about health statistics and health data and so on? So this is what I a little bit wanted to sort of frame this talk around. Why is it interesting for health organizations to bother about urban natural spaces? Well, to understand this, we need to look into what the global health disease scenario looks like. And these are numbers from the Global Burden of Disease studies, partly coordinated by WHO and the Lancet and so on. And 2004, so from this graph, from this table, you see that in 2004, it was still infectious diseases that were dominating the disease burden. But as we move ahead, and already by now, this is for 2030, but I think already today, we see a huge burden from mental health illness, mental health disorders, and other non-communicable diseases, and lifestyle-related disorders and environmental-related disorders. You see here, for example, road traffic accidents, clearly related and associated to the environment we're living in. So this is where we need to focus. This is where the urban planning comes into place, rather than maybe hospitals and healthcare clinics where I used to work. Because what causes the non-communicable diseases? We tend to talk about risk factors in this sense. We talk about stress, chronic stress, physical inactivity, loneliness. Loneliness is a major risk factor. You know, some studies show that it's as dangerous as smoking 12 cigarettes per day to be lonely, to have this perception of loneliness. So this is something that we cannot do anything about from a hospital side, but we can do something from a more societal, socio-environmental perspective. Climate change, obviously, is a strong risk factor for health. Environmental pollution and urbanization, unplanned urbanization, is also a threat to health. To bring in this, to bring the nature into this, why is it that we talk about nature then? Well, this is exactly the thing. Nature, urban natural spaces a lot of studies have suggested, have demonstrated, I would say by now, that nature, access to nature, exposure to nature, contact with nature can reduce these risk factors. A number of studies of various designs shows that people who live in green areas are more physically active, they have more social contacts, the chronic stress levels, both acute and chronic stress levels, tends to be lower when you're exposed to nature. And then you see on the top, we have the biodiversity. We talked a lot about biodiversity yesterday, and made me happy because I agree there were several speakers who talked about this, that without biodiversity, we don't have any human health either. We depend on the healthy ecosystems, right? And the regulating ecosystems, the ecosystem services we talk about, are of course dependent as well on biodiversity. Is the fundament for all of this. And the regulating ecosystem services, like the reduction of the urban heat island, for example, air pollution reduction, noise pollution, and so on, can also be regulated by these ecosystems, which has then positive impact on a number of health outcomes. So from, I can't list them all, there's so many studies by now that demonstrate that we see a reduced risk of depression, cardiovascular diseases, stroke, diabetes, asthma, cancer even, and so on. I could go on forever. Mostly cohort studies, mostly epidemiological studies, but also a few natural experiments, I would say. The thing with nature is that it also has this, what we talk about, salutogenic effect. It also promotes health. It not only prevents disease, but it also promotes health as such. Children tend to be more cognitively alert. People are happier in green areas. The sleep quality is better, and so on and so on. Okay. As I said, I could talk about this for many hours, and that's not what I'm here for. So just give you a few examples of the studies that are behind the statements I did on the previous slides. So this is a study by Thomas Astelbert and his colleagues in Australia on more than 200,000 people, where they basically looked at people living in more or less increasingly green areas. And you see that in areas where there is a lot of green, the risk, the opportunity, the chance that people are more physically active is almost 25% higher compared to if you live in no green areas at all, in areas with no green at all, even when adjusting for income, education, gender and age, sorry. Andrei Egorov and his colleagues used a biomarker, allostatic load. That's an index that can be composed of different biomarkers, but it basically measures the chronic stress levels in the body. And they found similar evidence that people who live in greener areas had lower levels of lower levels of chronic stress. A landmark study by Mitchell and Popham published in The Lancet 2008 showed also that the socioeconomic related health inequalities are reduced in greener areas. There's something buffering with the impact of green that reduces reduces the socioeconomic related inequalities. A recent study we published also suggested that the healthcare expenditures and the need for medicine are lower in green areas. Talking about biodiversity, I wanted to touch upon the biodiversity hypothesis, because the beautiful thing with a lot of this research is that we see that there is like a synergy. So while not only green areas, but in particular green areas that are biodiverse have a specifically strong impact on human health. And a few studies from a Finnish group, research group, have suggested that this is due to the impact on the gut microbiome. And there's a lot of studies coming out now that in particular relate the gut microbiome to a lot of health outcomes, a lot of disease prevention in children and in adults as well, for that sake. So if we could find even better evidence for the biodiversity link to health, I think we can really come up with this causal evidence, which is what we definitely need to be able to provide good messages to put this into even further into evidence policy and practice. So this is something I would like really to discuss during this meeting, how we can develop even better biodiversity maps on a larger scale to find better data for this. I realize I will be short on time, but this is such a beautiful study, and it uses a natural experiment design. It's in Karelen. Yes. Now, Karelin. Thanks. Before World War II, this was a homogeneous area, homogeneous region with a homogeneous population with similar diseases. But after World War II, it's a fascinating study where they collected data on birch pollen allergies and cat allergies. And you see on the Finnish side where there is more industrialization, higher hygiene levels and so on, you see an escalating almost increase in the allergies against both birch and cat. And they saw similar results for asthma, hay fever, and atopic eczema. Maybe I don't have time, but this was a quick, just on mental health as well, because it's an issue related to COVID, which was with COVID as such, the death toll was tremendous, but also the mental health, the mental illness toll was large. A 25% increase was estimated by WHO related to the confinements. And we looked at this in Barcelona or in Catalonia, actually, in a cohort of 10,000 participants, and found that people who lacked views of green space from their homes, the relative risk of severe depression was 2.5 times higher among those that didn't have any views of green from their houses, which is on par with the increased risk of living alone. So this is clearly this is a modifiable risk factor that we can do something about. And this doesn't, it's not such a shame, because it turned out yesterday that there is a lot of work on this, of course, and you know all of this already. So this is just an example from Vancouver, British Columbia, Canada, where I used to live and work before, on the common NDVI maps. That's one of the usual metrics we use to measure green in our health cohort studies. Using various satellites at different spatial resolutions. From the satellites, we can also use different other derivatives like EVI and unmixed pixel to get the percentage data instead, and land use and land cover. All this is from Metro Vancouver, right? Conclusions. What we need is, I already said this, I'm burning for the biodiversity aspect of it all, and I think it's nice because we have the synergy, and also to look at exposure data over time. And I was asked before, why is these things important? And I think if we can really collaborate even better, and I think as we said already, this is a great opportunity for this, to talk together between us. I think we have a chance to actually contribute to the Sustainable Development Goals, especially number 3, good health and well-being, number 11, sustainable cities and communities, and also the climate action. So therefore, I think these interdisciplinary events are really great and important. Thank you very much.